Hi, Chris Knott here, the Fit for Film strength and conditioning and injury expert. Today I'm going to be going through some acupressure points that you can use prior to training that's going to help your knees. Now, the key range of motion that the knees need is actually rotation. So it's a very sagittal plane dominant joint, as in like a hinge joint, but when it loses that small elements of rotation, it can be very problematic, leading to issues such as bursitis and strains on the ligaments. So if you want a very simple way that you can improve the way your knees feel, here's a very simple tip to use prior to training that'll go a long way. Okay, so before we begin, these techniques are not for acute injuries. So if you've gone over your knee or there is an acute impact or something which is very painful and there's swelling, that's when you need to go and see a healthcare practitioner. What these are designed to do is if your knees feel pretty sore or stiff and you're looking at ways to improve knee function for training, these can be very effective. So the first one that you're going to do is, if we go in the center of the kneecap and follow it down, we're going to get to this little nodule here on your tibia, which is called your tibial tuberosity. And you'll feel it sticking out around that region. Now, if we draw an axis right the way through the back, so imagine an arrow goes directly through the back of there, you're going to get into muscles at the back of the knee, and I just want you to push down in just gently. It's about a 3 or 4 out of 10, and you'll notice that there might be an area of increased tenderness. And it's very simple. All you're going to do is make small circles with your fingers. So what I've done is got these 2 fingers there. I've got my 2 fingers like so, and I'm just doing circles. It can be clockwise, counterclockwise, doesn't matter. Just applying a little bit of pressure. And it's just stimulating the muscles around the area to get a little bit more blood to them. Now, to know you're in the right place, if you bring your toe up like this and rotate from side to side, so just rotate your foot from one side to the other, it might increase the tenderness on that spot. Now, if the tenderness increases going from side to side, it shows you're on the right area. If not, just have a little feel around and there'll just be one part of the back of the knee or the muscles around the area which does feel like it's just, again, a little bit sore. So you're going to do those movements, so just circle them maybe for like 60 seconds, and again just moving the foot going from side to side like this, so rotating from one side to the other. And you just do this for a duration until you feel a change in the tissue quality, so it feels a little bit easier and a bit more relief to do. The second point is actually at the front, so we're going to go down again. Tibial tuberosity is our marker, and you're going to go about a thumb's width out to the side. You're going to go into this point, and you're going to again find this point again about 1 inch to the side of the spot that we're on about, and just do circles around this region. So I'm level around here, I've gone about 1 inch to the side, and I'm going to do circles, just finding a spot similar to before which has an increased level of tenderness. I'm just going to do circles gently. I'm about 4 or 5 out of 10. I can feel it, I can feel the tenderness, but it's nothing too uncomfortable. And this time, instead of doing circles, I'm just going to bring my foot up and back down. So bringing it up like this and back down. So pointing my toes, bringing my toes up. Pointing my toes, bringing my toes up. And again, doing circles until I've noticed the tissue change. I would do these 2 pressure points as you're warming up, so you could be doing your stretching. You can do different types of warm-up drills, maybe a couple of minutes on each knee until you've seen a change in tissue quality, and that'll be everything you need in order to improve knee function.